My role here is practice nurse, but I'm also the credentialed diabetes educator. So I have a dual role and I'm the only practice nurse here at this clinic. Apart from doing the diabetes clinic, we also do asthma clinic, we have mental health clinics, we do chronic disease management clinics. So there's quite a few sub-clinics within Bluestone that we run together with allied health and the GPs. So having nurse-run clinics in a primary care setting is a great advantage, I think, to the GPs as well as to the nurses. Obviously for the GPs, they've got the expertise of the practice nurse, which helps with patient education, patient motivation. You've got that one-on-one time with the patient a little bit more, so frees up the GP, I think, to be able to have that medical time with patients. Having a multidisciplinary team here at the clinic is really useful for patient care because we often have opportunities to talk and discuss about particular patients that may be having particular issues. So whether it be mental health or diabetes or chronic, some sort of chronic disease, we often have time to have a bit of a team meeting. We're focused together.
Patients have been really happy with it. They just, feel that they're getting more rounded, all-round service. I think the main one is having a good nurse who's running the clinic, that she's knowledgeable, that the doctors are all on board with it as well. They're the main two elements, I think, really.
I just think they get, by coming to a clinic that's got a nurse-led program, they get extra care. So they can see the doctor, have their consultation, and then they get that added time with the nurse, which makes such a difference. So there's often patients can be in a consultation with the doctors, they've forgotten what to ask. It's, sometimes it's busy, they don't get the time they need. So having the nurse-led care, they can then go and spend 10-15 minutes if they need to and just have a list of questions and just go through them and get them answered. Sometimes there's just a lot of therapeutic benefit in having people to talk with and spend time with you. So I think that's a real benefit as well.
Often I think as the practice nurse and the primary caregiver in some way, in the clinic setting, I think that we obviously are the people at the front line and are able to build those relationships with patients much better. So we've obviously been able to identify through having speciality clinics in general practice, identify higher needs of patients, and it's been able to help the GPs be able to target particular areas. So whether it be women's health or whether it be the patients that have high HbA1c levels for their diabetes. Just believe in their nurse and encourage their nurse. I think they need to, really encourage the practice nurse to have a little bit of, autonomy herself, because they've worked hard to get to where they are anyway. And offering those specific clinics also benefits your patients.